A new report from Sapien Labs, a neuroscience research nonprofit, looked at roughly 28,000 responses to their online mental health survey, and they looked from January to April of this year. Researchers looked at answers from 18 to 24-year-olds specifically. These are Gen Zers, the first generation to grow up with a smartphone, and we are talking about a cell phone with an internet connection. Researchers looked at someone's age when they got their first smartphone to see if it impacted parts of mental well-being, things like social engagement, self-esteem, and suicidal thoughts. The major takeaway, overall mental well-being scores were consistently higher when smartphone ownership began at an older age, both for females and for males. Now, one key finding, 46% of females experiencing mental health challenges received their first smartphone at the age of 18. 74% of females experiencing mental health challenges got their first smartphone at the age of 6. 36% of males reported experiencing mental health challenges got their first smartphone at the age of 18, compared to 42% who got their first smartphone at the age of 6. Suicidal thoughts, feelings of aggression towards others, a sense of being detached from reality, or even hallucinations were some of the most dramatic in females who got their phones at a younger age. Researcher Tara Thiagrajan says that this relates to the greatest impact they saw, something she calls a person's social self.
This is, encompasses all of the factors that, determine how you see yourself and your ability to interact positively and, with other people, form relationships, maintain relationships, and so on.
Now, this may sound very alarming for people watching who maybe you have a young child you've already given a smartphone to, or maybe you yourselves are someone who is a Gen Zer and has grown up with a smartphone from a very young age. Now, some important context when we are talking about this research. It has not been reviewed by scientific peers like a big study you might see published in one of the major medical journals. That's because Sapien Labs has instead wanted to release this data on their own as quick as possible to give a current snapshot of what things are like right now. There are additional studies on cell phone age and mental health, and at this point, we don't have a really clear-cut answer to what age is too young or just right to start using a smartphone. So right now, the way that the data is collected in these different research studies, it's often an apples to oranges situation. For example, you have this study we are talking about that's just coming out today. It had young adults self-reporting. It was a large group of people from dozens of different countries. We're talking thousands of responses. Now, that research, compare that to something that came out this past November from Stanford Medicine. That followed a small group of 250 students for 5 years and did not find a connection between the age a kid got their first cell phone and their sleep patterns or depression symptoms or grades. So what this all means is that more research is needed. So if you are watching this and you still want to help yourself, want to help a friend or family member, psychology experts say regardless of age, it is not just about limiting the time you are on one of these, but what someone is doing during that phone-free time. And they really suggest engaging, conversing, interacting, something face-to-face in real life with other people. Lindsay Thies, Scripps News, San Francisco.